An autoimmune disorder occurs when the body's immune system attacks and destroys healthy body tissue by mistake. Well, on this Wellness Wednesday, let's welcome back Dr. J.P. Saleeby, Medical Director of Carolina Holistic Medicine, for his monthly check-in to talk about these somewhat common conditions that affect nearly 7% of Americans. So great to see you back here.
Good to be here.
And yes, I mean, autoimmune disorders are some of the most common things that we tend to hear about. Can you give us a short list of what we're talking about?
So it's sort of when your immune system goes haywire and it starts attacking itself. And it's really complicated because it involves the innate and the adaptive immune system. Mostly the adaptive, they're the ones that make the antibodies. So if you have an illness and you're making antibodies to fight it, there's something called molecular mimicry, where the antibodies kind of mistaken our own tissue, whether it's joints, thyroid, heart tissue, as the enemy and attack it. That, in a nutshell, is autoimmune.
Right. And can you give us a short list of some of the conditions that we've heard of?
Sure. It's not a short list. There's about 120 to 125.
Let's stick with 5,
We'll take a few of them. Yeah. So MS, multiple sclerosis, is one. Hashimoto's thyroiditis, which is an autoimmune of the thyroid. And then you have its sister, Graves' disease, which is another autoimmune.
Yeah, I heard of these.
Then you have things like
type 1 diabetes.
Well, type 1,
right?
yes,
Yeah.
type 1 diabetes is an autoimmune, and then you have things like ulcerative colitis and Crohn's disease. Mm-hmm. Those are all autoimmune.
And rheumatoid arthritis as well,
All
right?
right, yes, that can be classified as an autoimmune disorder.
How do these usually get treated?
Well, in mainstream medicine, they usually use things to suppress the immune system, like prednisone. So the whole thing is either suppress or control a kind of runaway immune system. They use biologics that are monoclonal antibodies that will attack certain parts of the immune system. They also use chemotherapeutic agents like methotrexate and things like that, gold therapy, things like that, to suppress the immune function. Whereas in sort of the integrative approach would be to help regulate the immune system instead of suppress it.
It's kind of a broad question, but are there cures for autoimmune diseases?
Yeah.
There are. What about the ones that you mentioned?
So with MS, you can put it in remission. There's Hashimoto's. You can get people's NPO titers to go down.
And that's what this book is based on.
Yeah, so there's chapters in this book, Stop the Thyroid Madness, Volume 2. There's actually 3 books, but the second book deals with the autoimmune. There's chapters on Hashimoto's and how that all works.
How does Hashimoto's manifest itself?
Things like hypothyroidism. It's the leading cause of hypothyroidism in women in this country. And it's unfortunate that the most prescribed drug for that is levothyroxine or Synthroid, and that's only effective in about 10% of women. Oh. So 90% need something different.
It sounds very synthetic.
Well, it is. It's T4 only. It's derived synthetically.
It is. Okay. Mm-hmm. So how would your approach look different from, say, some of the pharmaceuticals that we tend to hear about?
So we use porcine or pig-derived or bovine, cow-derived thyroid glandulars, and they're called natural desiccated thyroids. Things like people might be familiar with Armour or NP thyroid or Nature-Throid. Those are different comparable compounds that we use. Plus, we also do sustained release. Mm-hmm. So if we figure out the right dose of T3 and T4 for our patient, we could put it in one capsule and make it sustained release so they take it 1 time a day.
Yeah, and for multiple sclerosis, I know people need injections on a pretty regular basis, and that gets old real fast.
Right.
Is it still the same treatment of getting injections if you take a holistic approach? Or?
Well, there are injections. Some of those are monoclonal antibodies. There's an oral called Gilenya that's oral MS drug, but the magic bullet is actually LDN, or low dose naltrexone. Mm-hmm. So the director, Linda Elzegood, who's the editor of that book, is actually an MS patient, and she was bed-bound, wheelchair-bound. In England. She lived in London, and they threw everything at her Western medicine had to offer, and she was progressively getting worse.
Oh, no.
Until she found a doctor who was prescribing this newfangled thing called LDN, and she's in full remission. When I go with her to conferences, I can barely keep up with her. She's a dynamo.
You're kidding.
So, yeah.
So you've had personal experience with her, and you've seen her journey.
Oh yeah, I've seen hundreds of patients journey out of
to this point.
Right,
it's
and so much so, I'm so impressed with it on its anti-cancer, anti-autoimmune properties that I'd take it myself.
Is that right?
Yeah.
Well, one of these days we're going to have to get into exactly what you take on a daily basis. I would
Sure.
be you're very healthy,
Yeah.
I can tell. So, and diet as well.
Right.
I want to know all the details.
I practice what I preach, right?
But when we're talking about this, it's considered a magic bullet.
I would call it so, yeah.
Yeah. And can it be applied to other issues that are non-autoimmune?
Yes, so it's used to enhance the immune system. So a lot of my Lyme patients are on it. It's used as an anti-cancer agent.
Okay.
So a lot of people with oncological problems that see me will be on it for that.
Okay.
So it has many applications, even for MDD, major depressive disorder. They found out accidentally that people on LDN, it helped where SSRIs didn't.
Real quick, cost comparable?
Cost is less. Insurance is not likely to pay for LDN, but it's around $1 a capsule no matter what dose you take.
All right, and of course you want to check in with your primary care physician and Dr. Saleeby as well.
Yeah.
Appreciate it.
Okay.
Thank you so much. We're back after this.